I want to welcome back to the program Dr. James Pickney II. He's a board-certified family medicine physician. Dr. James studied general surgery at the prestigious Cedars-Sinai Medical Center in L.A., graduating from Baylor College of Medicine right here in Houston. He's the founder and CEO of Diamond Physicians. It's concierge medical practice focused on the patient-physician relationship. Diamond bypasses cumbersome and inefficient middlemen, the folks that I call the traitorous insurance companies, to deliver personalized, high-quality medical care to its valued clients. Dr. Pickney, welcome back to the Voice of Texas, AM 700 KSEV.
Hey, good morning, Chris.
There was a story that caught my eye, and I definitely wanted to get your take on this because this is kind of what you and I have talked about in the past, this idea of a competitive marketplace in medicine as a mechanism to drive down costs. Are you ready for this? Walmart is offering to its employees and to the public low-cost medical care. A clinic in Carrollton, Georgia is ready to start seeing patients. Those who use the clinic will pay $4 if they are covered by Walmart's employee health plan, $40 if they are not. At first blush, what do you think of this, Dr. James?
Well, I think it's a great idea. Just like you said, we need more competition to drive down prices in this marketplace. So Walmart is doing exactly what Diamond strives to do. That's provide affordable care, exemplary care at an affordable price.
Now, they are able to do this because they staff these clinics. And by the way, they are test marketing them in 3 states, South Carolina, Georgia, and right here in the great state of Texas. They are able to do this. They staff these on-site clinics with nurse practitioners. And as I understand it, nurse practitioners, not exactly full-fledged doctors, but not exactly nurses either. They're kind of somewhere in the middle as far as their training are concerned. They're able to write prescriptions, and they operate under the license of actual doctors. Do I have that about right?
That's about right. Typical nurse practitioner is going to go through about 4 years of school, and your physicians are going to go through at least 8 years of school. So not quite as much schooling as a physician, but the same courses at an expedited pace.
Yeah, and able to, basically diagnose the everyday aches and pains, colds, infections, that kind of thing, and get folks on their way, which would take up which would free up, I would imagine, doctors to handle the more serious cases, I suppose.
Yeah, nurse practitioners are a great way to take care of routine chronic illnesses, hypertension, which is high blood pressure, diabetes, high cholesterol. Those are things that nurse practitioners can definitely manage. I know a lot of wonderful nurse practitioners, and they will play an integral part in our healthcare system moving forward because there is a huge physician shortage.
Now, at Diamond Physicians, you guys have nurse practitioners as well, right?
We have one nurse practitioner more on a backup call basis. So
sure.
A lot of people really like to see the physician. So our model is based around physicians. However, when you have more of a high volume model like Walmart, nurse practitioners are a great way to fill that space. And
I think you said it. By the way, Dr. James Pickney II is my guest right now. Dr. James, board-certified family medicine physician. He is the founder and CEO of Diamond Physicians. It's concierge medicine, a direct response to the threat that Obamacare poses to the United States medical community and to medicine in general here in the United States. But this all of the above approach, which is a foreign concept to most liberals in government, whereas everybody has I guess a section that they can plug themselves into to help solve the problem and get folks the medical care they need. That's why somebody like you would look at what Walmart is doing and say, hey, yeah, that handles a certain segment of the population, the low-income folks, who could really benefit from that.
It does, and actually we have a very similar program called our Diamond Solutions Plan, where we target small businesses and allow them to create a healthcare plan that's very similar to the ones that large corporations can afford, like Walmart, to implement for their employees. So we pair them with a partially funded self-insured plan, and we get an automatic 10% discount because the insurance companies know that when an employer works with a direct primary care practice like ourselves, their employees become more healthy. We keep them out of the hospital. We control their chronic diseases, so they get an automatic 10% discount on their insurance premiums. So you pair that with direct primary care, and all of their employees have 24/7 access to a physician. It's a wonderful concept that we are putting in place. We just signed an eye doctor to this program, and his employees are absolutely loving it.
Yeah, Walmart is calling this a $4 wake-up call to providers. And I got to ask you, we have heard nothing if not consistent drumbeat of the escalating cost of health care. But here comes Walmart saying, hey, you know what, we're going to allow you to see a nurse practitioner, get your basic needs met for $4 a visit if you're an employee and $40 a visit if you are not. Why are they able to, and you knowing the costs of what things actually cost in the medical realm, why are they able to offer this service at such a low cost?
Well, Walmart did their cost analysis, and they spend $500 million a year on health care because their employees were going to ERs, freestanding ERs, urgent care centers, and things of that nature, where the price inflation is just ridiculous. So they kept it in-house. They brought everything in-house. They're going to salary nurse practitioners, and they're going to charge $4. And by staying on top of preventable disease, they will stop all these ER visits. And that's what's driving up the cost. And that's exactly what Diamond does.
Well, I appreciate your time this morning. I know you got to get off to a speech. Dr. James Pickney II, he is the founder and CEO of Diamond Physicians. Dr. James, where can they go if they want to find more information about Diamond Physicians?
And go to diamondphysicians.com. You can email us at info@diamondphysicians.com or follow me on Twitter at _Dr. James. Thank you so much for having me on the show.
You betcha. Always appreciate the expertise. More to come on the other side of the break, folks. We'll pivot back to